community and those who love and care for them. I am your host, Shawn Perry, and today we're diving into a topic that touches every family. I'm talking about advanced care planning and palliative care. Joining me is Jim Farnham, President and Strategic Leader of OneAccord Health and a proud member of the African American Leadership Council with Compassion and Choices. Jim is an advocate for end-of-life care planning and has been instrumental in creating accessible platforms for storing and sharing advanced care directives. This segment is also brought to us by Compassion and Choices. Jim, thank you for joining us here on the Senior Zone.
Thank you, Shawn, for giving me an opportunity to talk about topics that I'm really passionate about.
Well, Jim, let's just start with the basics, my new friend. For our listeners who might not be familiar, can you explain what advanced care planning and palliative care are and why they are so important?
Well, Shawn, OneAccord Health was launched, really out of our desire to make sure that no one experienced what we experienced at the end of my mother's life. OneAccord Health, a family business, was founded by myself and my two sisters. One's a nurse practitioner and PhD who specializes in advanced care planning and palliative care. And the other one is an internist and gerontologist. So imagine not having the opportunity to discuss end-of-life preferences with your dying mother because she had the opportunity to have discussions. She actually shut down a lot of discussions saying that she didn't want to talk about it at this time. And so it had a tremendous impact on us, and we vowed that we want to make sure that other families didn't have to experience this. So to put a finer point on your question that you asked about advanced care planning and palliative care, advanced care planning helps you to document your healthcare preferences so that your loved ones and your doctors know exactly what you want if you can't speak for yourself. It ensures your care is aligned with your values and gives you some peace of mind. Mm-hmm. On the other hand, palliative care focuses on your comfort and well-being by managing the pain and symptoms. It also supports not only your physical health, but also your emotional and spiritual needs, helping you to live as well as possible for as long as possible.
Yeah, well, thank you for that interesting and enlightening perspective, Jim. For many families, as you already know, starting a conversation about end-of-life planning can be tough. What are some of the biggest challenges families face, Jim, when trying to begin these conversations, and how can they overcome that initial discomfort?
End-of-life discussions, frankly, are not being had. Mm-hmm. It's a taboo subject. It's as if discussing death and dying will somehow hasten your demise. And the fact is, nothing could be further from the truth. We plan our vacations, our careers, and even our retirement, but when it comes to death and dying, numbs the world. We have to change the narrative on this topic. I think about recently, I started to see all these ED commercials on television. 5 years ago, no one talked about ED. But now you can't really turn on the television without seeing it. So what I'm saying is that from a branding perspective, we have to increase the awareness by talking about these topics and changing the narratives and make them more normalized.
Yeah, you make an excellent point. In these conversations, while they may be uncomfortable, but they are so necessary. I want to talk to you now, Jim, about tools and resources. You've been a trailblazer in developing online databases for advanced care directives. Can you tell us more about these platforms and how they're making it easier for families to organize and share their plans?
Certainly, Shawn. Everyone I speak to would agree that advanced care planning is important. It's just not a priority. There are a number of free programs that are out there. Some of them are downloadable forms where people can fill them out, but they have really sort of low adoption. And part of the issue around that is that people need to be educated. They need, in a lot of respects, they need have questions answered while they're doing these forms. So what we've developed is a facilitated virtual session that helps individuals to complete their plan. And it takes about 30 to 45 minutes, which is going to include them identifying a healthcare surrogate and even someone that would witness that form. Our professionals use a digital platform to help develop, share, store, and retrieve those plans when it's needed most. Through information hubs, that information is connected to about 80% of the hospitals nationwide, which means that if for some reason you become incapacitated, those plans will follow you into the emergency room, and they'll be able to pull down your wishes at that point. You know, a lot of times the advanced care plans that are written and documented is in your safe somewhere, and they don't necessarily follow you and available when you need it most.
Yeah. Well, that sort of connectivity is certainly impressive. Having everything organized, Jim, can certainly make and take a lot of stress, out of a difficult time. But technology isn't the only piece of the puzzle. And as a member of the African American Leadership Council with Compassion and Choices, I'm going to let you do this because I'm also a member of the council. How do you address the unique cultural and historical barriers that communities of color might face when it comes to planning for end-of-life care?
That's a really, really good point. You have to meet people where they are. For example, my father-in-law, when we were trying to complete his end-of-life plans, told us that God healed him. He had stage 4 colon cancer that metastasized throughout his body, and he had treatment and he was in remission, but he believed that God had healed him. So, some people, some communities would use that as a conversation stopper, but we used it as a conversation starter to really try to really understand what his values were and what he wanted to accomplish. So we started asking questions, well, hey, what if God called you home? Is there anything that you would like to do before, he called you home? And it started a conversation where we weren't really working against him, we were working with him to identify what was important to him and his preferences toward end of life.
Yeah. It's just crucial, you know this already, to address those barriers. And as you said, meet people where they are. And it sounds like, well, I know for a fact that, Compassion and Choices is doing amazing work in this area. Let's shift, Jim, to palliative care, specifically with the time that we have. Some listeners might not fully understand what palliative care really entails. How is it different from hospice care? And at what stage should someone consider palliative care?
So hospice care is end-of-life care. And so you're no longer going for curative intent at that point. So they will administer some palliative care, but it's usually for pain and symptoms. When we talk about palliative care, we're talking about whole body care. We're talking about mind, body, and spirit, quality of life, not only pain and comfort. We're also talking about spiritual and quality of life and all of those intangibles, not only for the patient, but also for the family. And the big thing about palliative care is that it should walk alongside of curative intent. So if you have a serious illness, like, stage 4 cancer, like my father-in-law had, we should be talking about palliative care kind of all the way through, and not just waiting until the end, which is where you would normally have discussions about hospice.
Gotcha. And that distinction between the two, palliative care and hospice care, my friend, is helpful to understand. Speaking of which, let's touch on the legal aspects of advanced care planning. What are some key legal documents, Jim, that everyone should have in place? And what's the best way to ensure they're honored in a medical setting?
Well, everybody's going to talk about the will and the living will, and those are really, really key documents to have. In the living will, there's an advance directive. It talks about what you don't want. Our advanced care plan talks about what you do want and your values and preferences, and making sure that that's included. So those three documents, I think, are extremely important. But, when we start having these discussions with members in our community, what we realize that they also need to have other documents. A lot of times they don't have insurance in place. They may not have a financial advisor or a spiritual advisor. And those end-of-life resources are equally important, in my judgment, to make sure that we're ministering to the whole person.
Absolutely. Having, those documents in order, as you just, alluded to, is certainly essential. But even with a plan, we know families often face tough decisions. When families, Jim, find themselves in disagreement over a loved one's care, what advice do you give to help them navigate those?
Family disagreements and conflict is inevitable. When we're thinking about end-of-life planning, we're really putting the patient or the individual, the loved one, in the center of that conversation. The advanced care plan allows us to document their wishes in such a way that we're incorporating their values and preferences. So it should alleviate or help to alleviate the end-of-life decision-making burden that really falls on loved ones if they don't know what your wishes are. And so our goal is to make sure that you know what your loved one's wishes are and not trying to figure it out at end of life. You're in a much better position if you're pulling through their plan versus trying to figure out exactly what they wanted.
That is the soundest advice that I've heard, Jim. So great information. Let's, Jim, end with a forward-looking question for our listeners. If you could leave our audience with one piece of advice or a first step they can take today to start planning for their future care, what would it be?
So one of the things that we realize, especially with the pandemic, is that everyone needs an advanced care plan, because death can strike at any time and to anyone, right? So all bets are off. I would say the first step is let's start to have those conversations with loved ones that maybe are seriously ill. And we kind of mentioned this earlier. Start slow. You're not going to complete this conversation or a plan, for example, in one conversation. It may take a series of conversations. You may, at Christmas time or Thanksgiving time or whatever, begin to have those conversations where you look a person in the eye and start talking about, hey, we're all going to die at some point. So let's start to have a conversation about what's important to you so that we make sure that your wishes are respected when it matters most.
Yeah. Well, Jim, we are out of time, and we've been speaking with Jim Farnham, president of OneAccord Health. Jim, I want to thank you so much, my new friend, for sharing your expertise and just shedding light on this vital topic. We need to have it more often. End-of-life planning is something that we should all take seriously, and it's clear, Jim, that the work you're doing with OneAccord Health, as well as with Compassion and Choices, is making a real difference. To our listeners out there, remember, taking the time to plan now means giving your loved ones the greatest gift of clarity and peace when they need it most. You can learn more about these resources by visiting compassionandchoices.org. Again, that's compassion and, that's A-N-D, choices.org. Thank you for tuning in to the Senior Zone. Until next time, be safe, stay engaged, and remember to celebrate your life journey every step of the way. Jim Farnham, thank you for joining us here on the Senior Zone.
You're welcome. My pleasure.
All right. Take care, my friend. Folks, this next